Dr. Kema Onu, FCT coordinator of AIDS Healthcare Foundation, AHF, says the condom is the only realistic measure for ending HIV/AIDS and sexually transmitted infections, STI, by 2030. Onu told News Agency of Nigeria, NAN, at the event to commemorate the International Condom Day, ICD, in Abuja.
HIV is the other pandemic we should not look down. That is why we have tried to incorporate services that are related to HIV with COVID-19. In centers where you have COVID-19 testing, we also want to have HIV testing. We awakens the consciousness of persons to realize that while you are fighting COVID-19, HIV is still the other pandemic indeed.
The event was organized by the foundation in collaboration with National Agency for the Control of AIDS, NACA. Ono expressed the determination of the foundation to continue to mitigate the spread of HIV through events like International Condom Day.
It's still another opportunity for us to reawaken the consciousness of Nigerians that condoms have become the most realistic measure of ending AIDS. Persons who consistently and correctly use condoms, they reduce the incidence of HIV and AIDS. So we are not preaching sex, we are not preaching unfaithfulness. We are trying to be very realistic in the face of the epidemic, in the face of the data we are saying that consistent and correct use of condoms is the way to go.
Similarly, Dr. Gambo Aliyu, Director General, National Agency for the Control of AIDS, who also described condom as a key component of comprehensive HIV prevention strategy, said it was not targeted at promoting promiscuity.
If people have a negative view about condom, you can't blame them. All we need to do is to work hard to convince people that the negative effect or the negative aspect of condom is small compared to the positive aspect that we're looking at. Consider HIV, consider other STDs, consider unwanted pregnancies. But the negative aspect is promiscuity. We're working on it, and we're doing our best to make sure that people see condom positively rather than negatively. And people use condom more correct and consistent rather than thinking of condom, to promote promiscuity.
One of the beneficiaries of the free test, Mr. Ayo Salihu, thanked the foundation for the opportunity to examine his HIV status.
But the time of our youth is not time of youth of nowadays. So that time of our youth, we know how we do. Not like our father, we would teach us, don't closer to woman. But nowadays, not like that. So my advice to youth, especially this Valentine Day, also my advice to youth is that if you are moving with anybody at all, or with your friends, make sure you prevent yourself not to contract any disease, because it didn't show for face. It didn't show for face. It don't show for face. So anywhere you are going, you are moving with your friend, make sure both woman and man, make sure protect yourself by using condom. It's very, very important.
Lillian Eze, a student of Nasarawa State University, lauded the foundation for the free HIV testing and condom.
And when I was growing up, we used to hear about HIV things and all that, and that thing created fear in us. But now, girls, you see 18 years old girl, 15 years old girl don't even care about HIV and all that. She just wants to get down. But I'm really glad, and in fact I was happy when I saw you guys coming. I was like, no, this is another opportunity for me because I'm never scared of doing my HIV test. Yeah. So I'm really, really happy. My own wish now is if people can go further, especially to schools, campuses and all that, because a lot of things are happening there.